This is an EIA test for H. pylori, and we are looking for H. pylori antibodies, which means that our test cartridge is going to have a tagged H. pylori antigen. So our specimen has the antibody, our test kit has the antigen. The test kit contains everything you need in it. Once again, we have our little idiot sheet or pictures, which makes it a lot easier to do these sometimes, but there's a lot more information in the package insert, so if you ever have questions, all you have to do is refer to it. H. pylori is a bacteria that is found in the stomach that is associated with ulcers and gastritis. Approximately 25% of the population is asymptomatic and has it. So just because you have it doesn't mean it's causing problems. It's if you have problems, it may be what the cause is. We have some calibrated pipettes. Which I'm going to make a fool of myself trying to get out of here. You have to take the little foam piece out of the top. And if you can see, there's a green line and a red line. The green line is going to be used if we use serum. The red line is going to be used if we're using whole blood. We can actually draw this directly off of a finger stick and do the test directly from a finger stick. Many of these EIA kits work that way. So what I'm going to do is I'm going to fill this, because I'm using serum, I'm going to fill it to just the green line. I'm then going to apply the sample into the sample well. And I follow that with 2 drops of developer. The procedure for whole blood would be the same, except I would fill it to the red line. As with our other tests, you can see as it begins to migrate across. I know, it's like watching paint dry. It's so exciting. We're going to be looking just like all our other test kits for our control line to come up. That's going to tell us that our test is valid. We're going to look for a positive line at the test site. That would be a positive test. A lack of a line at the test site would be a negative test. And I actually have a positive test cartridge here to show you. So the control line is there, which means our test is valid. And the test line is there, which means that our test is positive. We would read our actual patient 10 minutes after we've started. Always make sure you know maximum time, because after 20 minutes, this test is no longer valid. You have to start all over. So make sure you read the package insert carefully.